My name is Sanjay Gupta, I'm a cardiologist. So today this video is entitled When Bigger Kids Get Smaller Care. So if your 17-year-old is taller than you, heavier than you, and physiologically an adult, should they not be treated as one? You see, in many cases of POTS, POTS stands for postural orthostatic tachycardia syndrome. I've done lots of videos. So in many cases of POTS and dysautonomia, the answer should be obvious, but it isn't. And too many young people are paying the price. So in medicine, we have this invisible line, the 18th birthday. Before it, you're a child. After it, you're an adult. The problem is that this line is legal, not physiological. The day before your birthday, you can be exactly the same height, weight, and body composition as you are the day after. Yet we suddenly decide that the rules, the medications, the doses all change overnight. And because of that, we have a generation of teenagers, some taller, heavier, and stronger than their parents, who are being undertreated for serious conditions like POTS. Let's be clear, most medications don't care how many candles are on your cake. They care about how your body processes the drug, about your weight, your surface area, your liver and kidney function. A 90-kilogram rugby-playing 15-year-old has more in common pharmacologically with a 30-year-old adult than with a 9-year-old child. Yet in too many clinics, we're still reaching for the pediatric dosing table, or worse, we are avoiding treatment altogether. Why this hesitation? Part of it is medico-legal fear, the sense that if you prescribe an adult treatment to someone under 18, you are stepping into dangerous territory. Part of it is the lack of trial data, because many drugs have not been formally tested in under 18s, especially for conditions like dysautonomia or POTS. And part of it, frankly, is comfort zone medicine. It is easier to do nothing than to take a decision you might have to defend. But here is the uncomfortable truth. Inaction is not neutral. Inaction can be harmful. And let me just talk you through the cost of comfort zone medicine. For these teenagers, the cost is huge. They miss months, sometimes years of school. They fall behind socially. Their bodies decondition. Their symptoms spiral. And their mental health suffers. Families get desperate, searching online for help because the system is too afraid to offer it. And by the time they reach adulthood, they're not just battling POTS, they're battling years of lost potential. And therefore, there needs to be a call for courage and common sense. Medicine is about weighing risks and benefits, not just ticking legal boxes. If a patient's physiology is adult-like, if their symptoms are severe, if the treatment is evidence-based and well tolerated in adults, then surely it is common sense to consider that treatment earlier. Yes, it means informed consent. Yes, it means careful monitoring. But avoiding it entirely because of a birth date, that's not caution, that's neglect. The safest medicine isn't the one that does the least. It's the one that does the most good for the person in front of you. And sometimes that means stepping outside your comfort zone, especially when the patient is bigger than the comfort zone itself. I'd love to hear your thoughts.